Welcome back to HealThrive, and thank you for joining me today. If you want clear, reliable, and in-depth updates about everything happening in the world of health across the United States, then you're exactly where you need to be. Today's deep dive video, titled Complete U.S. Health Report, New Research, CDC Alerts, and Healthcare System Updates, brings together the most impactful developments shaping America's health landscape right now. Stay with me until the end, because each update connects to the next, and by the time we finish, you'll have a complete picture of what these changes mean for your daily life, your safety, and your long-term well-being. Let's begin with the rapidly evolving field of medical research. Across U.S. universities, hospitals, and laboratories, new studies are pushing the boundaries of what we know about disease prevention and treatment. Scientists continue to focus heavily on early detection of major chronic illnesses, such as heart disease, diabetes, and certain cancers. What's exciting is the shift toward personalized medicine. Instead of relying on general treatment plans that work the same way for everyone, research is moving toward more individualized care. Doctors are using more advanced testing, risk assessment tools, and patient data to tailor treatments uniquely to each person's biology and lifestyle. This makes treatments more specific, more effective, and often less stressful for patients. Another major area of research involves lifestyle-driven health trends. Several recent long-term studies reinforce how deeply sleep, nutrition, stress, and physical activity influence the body at every stage of life. Researchers continue to highlight the link between chronic stress and heart disease, as well as the effects of processed foods and inflammation. Exercise science is also evolving, and new evidence shows that even moderate, consistent activity can dramatically reduce long-term risks for many common conditions. At the same time, the growing interest in mental health has led to more studies focusing on anxiety, depression, burnout, and the effects of digital technology on mood and attention. These findings are helping experts refine recommendations that better fit real, everyday life. Meanwhile, medical technology is advancing just as quickly. New devices, AI-driven diagnostic tools, and improved imaging technologies are helping doctors detect diseases earlier and more accurately. Portable health devices are becoming more common, giving people real-time data about heart rate patterns, glucose levels, sleep cycles, and more. This increased access to personal health data empowers individuals to identify issues early and take action before small problems turn into serious complications. The integration of virtual care is another major step forward. Telehealth is no longer just a convenience, it's becoming an essential part of the healthcare system, making it easier for patients in rural, underserved, or busy environments to access professional medical advice. Now let's move to current CDC alerts and public health recommendations. Each year brings new concerns, seasonal risks, and adjustments in national health guidelines. The CDC continues to monitor respiratory illnesses, infectious disease patterns, and environmental health risks across the country. Seasonal flu remains a major concern, especially for children, older adults, and people with weakened immune systems. Updated guidance emphasizes early treatment, timely vaccinations, and increased awareness of symptoms that should not be ignored. Respiratory viruses tend to spread more during colder months, and the CDC encourages preventive habits such as proper hand washing, staying home when sick, and avoiding unnecessary exposure in crowded indoor spaces. Along with that, the CDC continues to track emerging health concerns, such as changes in viral patterns, regional disease clusters, and environmental factors affecting air and water quality. Public health experts are increasingly focused on the impact of extreme weather events, Heat waves, wildfires, and poor air quality can significantly affect respiratory health, especially among people with asthma or heart conditions. The CDC urges communities to stay alert to local air quality reports and take precautions during high-risk days. Another area receiving attention is food safety. Reports highlight the importance of proper food handling, safe storage, and awareness of contamination risks related to meats, fruits, and packaged goods. Foodborne illness trends show that even small mistakes in handling or cooking can lead to serious health problems. So the emphasis is on awareness and prevention. Mental health continues to play a central role in CDC alerts. Rising levels of stress, anxiety, loneliness, and burnout across the U.S. have prompted new recommendations. Experts are encouraging people to prioritize consistent routines, limit excessive screen time, build meaningful social connections, and seek support early instead of waiting for symptoms to worsen. Mental health is now recognized as a core part of overall wellness, and resources are increasingly being made available to help individuals and families manage these challenges. Turning to the U.S. healthcare system, several ongoing changes are shaping how Americans access medical care. Telehealth remains a major player, offering remote appointments, digital prescriptions, mental health consultations, and online monitoring services. This shift is improving access, reducing wait times, and making healthcare more flexible for people with busy schedules or transportation challenges. Many insurance providers have expanded coverage for virtual care because it's effective, affordable, and convenient. Another notable trend is the growing focus on preventive care. Healthcare providers are encouraging patients to schedule annual checkups, screenings, and blood tests earlier and more regularly. Preventive care reduces long-term medical costs and improves quality of life because problems are caught before they become severe. At the same time, hospitals across the country continue to modernize their facilities. Many are investing in updated equipment, digital systems, and new technology to improve patient outcomes. Upgraded emergency care units, more efficient record keeping, and improved diagnostic tools are making treatment faster, safer, and more accurate. Pharmaceutical updates also play a major role in system-wide changes. New medications are entering the market for chronic conditions such as diabetes, heart disease, and autoimmune disorders. Many of these drugs are designed to be more effective with fewer side effects. Some new treatments also focus on reducing dosage frequency, giving patients greater convenience and consistency. These improvements reflect the broader movement toward simpler, patient-centered care. Insurance policy adjustments continue to affect what people pay for healthcare. Some plans now include expanded coverage for mental health, telehealth services, preventive screenings, and certain medications. At the same time, the ongoing conversation about affordability remains active. Rising costs for some medical services, prescription drugs, and emergency care have led to new policy discussions about improving fairness and access across the country. Experts are working to create long-term solutions that help reduce financial pressure on individuals and families while maintaining high standards of medical care. As these changes unfold, many experts stress the importance of personal responsibility when it comes to health. Staying informed, making thoughtful choices, and following recommended preventive practices can significantly reduce health risks. Whether it's improving your sleep schedule, cutting back on sugary foods, adding short walks to your day, or staying up to date with vaccinations and screenings, small steps make a big difference over time. Health experts also emphasize the need for balancing work and rest, digital use and real connection, fast-paced living, and mindful routines. Before we wrap up, let's reflect on what all of this means for you. The U.S. health landscape is evolving quickly. Research, is revealing new insights every day. Public health organizations are updating recommendations to keep pace with new data. The healthcare system is shifting toward greater accessibility, greater personalization, and greater preventive care. The more aware you are, the better decisions you can make for your health and for the health of the people you care about. Thank you for watching this full report from Health. If you found this video helpful and want to stay updated with clear, reliable, and well-explained health information, make sure to hit the like button, subscribe to the channel, and turn on your notifications. Your support helps this community grow and ensures that more people can access trustworthy health updates. Stay healthy, stay informed, and I'll see you in the next video.